Senid. I am Diana Hernandez, Public Information Officer, serving you at your local Garfield County Health Department. And with me today is
John Gray.
John, you do?
I'm the COVID tracer for the Garfield County Health Department.
And you do that very well. Alrighty, we're going to jump into some awareness. And John, do you want to lead us in there? And let's go ahead and go full screen.
Well, rabies is a serious viral disease that is often fatal. It is critical that persons exposed to rabies seek immediate medical attention and be treated with a series of shots called rabies post-exposure prophylaxis. This treatment should be started as soon as possible after exposure to the disease and will effectively prevent rabies from developing in humans. Acute Disease Services at Oklahoma State Department of Health employs a team of epidemiologists who are on call 24/7 to help determine if someone has a rabies exposure risk after coming in contact with an animal suspected of or confirmed to have rabies. It is determined you have been exposed. Oh, I'm going to have to do that again. It is determined if you have been exposed to rabies. OSDH recommends you receive rabies PEP. You should take the following steps. 1. When seeking medical attention to treat an animal by wound resulting in rabies exposure, advise the attending doctor that OSDH recommends you receive a rabies PEP. There may be situations where there is no apparent tissue injury and PEP is recommended. In those cases, contact your doctor or other medical facilities, e.g., an emergency room, and tell them you've been exposed to rabies and ask if they administer rabies PAP. Rabies PAP treatment is considered a medical urgency, so do not delay in making arrangements to receive rabies PEP treatment. Please call 405-271-4060 to speak with your on-call epidemiologist any time of day if you need additional information.
Awesome. So we are now in March. In March 20th to 26th is National Poison Prevention Week. And so a little bit about that is when, of course, life happens. Poison centers are ready 24/7, 365 with fast, free treatment advice by calling Poison Help 1-800-222-1222 or visiting poisonhelp.org. Whether it's a question or an emergency, Poison Help can provide life-saving information when people need it most, and calling a poison center is faster and more accurate than an internet search. An average 90% of poisonings happen in America homes each year, and more than 70% of people who call Poison Help get the help they need right where they are, saving the cost of a trip to the doctor or hospital. So again, this year, National Poison Prevention Week is March 20th to 26th, and it is dedicated to raising awareness about poison control centers and the Poison Help hotline. Again, that is 1-800-222-1222. All right, so let's embark on COVID numbers for Garfield County. Now, for the cases over 30 days, so that's on average, the sum of the last 30 days is 736 for Garfield County. The 7-day average of daily new cases is 16.7, and the total vaccinated for Garfield County is 53.4%. The total death count for Garfield County is 263, and I know that these numbers may sound a little tricky, and if you guys have any questions, please feel free to contact myself, Diana, at the Garfield County Health Department. I'll be happy to go through the changes, because these updates and how they update the data has changed, so I would be more than happy to explain that. And we are still promoting the same thing that we did in the beginning of the pandemic, and even now, wash your hands, wear a mask, be mindful of if you're immunocompromised or mindful of those who may be immunocompromised. Be aware going into large crowded spaces, and just be mindful. And another tool is vaccines. We do have vaccines available at Garfield County Health Department, the primary shots, and additional booster shots as well. These are some symptoms. Now we are at a decline, but it is still there. So luckily, this is a little chart here to help you see and kind of self-monitor when it is time for you to get self-tested. And of course, Garfield County Health Department is happy to help you with your COVID testing needs. We do have rapid testing as well as 3-day testing. If you want a more accurate testing, we send off to the laboratory. You can call at 580-233-0650 or schedule an appointment at osdh.emitech.com. And we can go ahead and go normal screen. And that is all the updates that we have today. We are trying to shift our perspective to more information to give to you guys. Then COVID is important, but there's also equally important information that we want to share with you guys, like the rabies awareness and the Poison Prevention Week that are coming up this month. So thank you so much for spending this time with us at our community health update. And John, do you have anything else you want to close us out with?
I think you've covered everything.
All right. Well, thank you so much, Enid. Until next time, thank you. Bye.